Healthcare delivery systems. LPNs practice within the healthcare delivery system as a whole. To achieve their greatest potential, nurses must be aware of the complexity of this system and the vital role that nursing plays in its functioning. Healthcare system defined. The healthcare system consists of a network of agencies, facilities, and providers involved with healthcare in a specific geographic area. Many categories of healthcare professionals operate within this system, including the LPN, LVN. This healthcare environment includes the patient, the patient's family, the community in which the system operates, technology, governmental and regulatory agencies, the medical profession, third-party participants like insurance companies, and many other forces that affect the patient's care. The major goal of this system is to achieve optimal level of health care for a defined population. The means of achieving this goal is provision and adequate and appropriate health care services. The LPN is an integral member of the team of healthcare professionals who provide these services within the scope of practice as defined by the State Nurses Practice Act. Wellness-illness continuum. The range of a person's total health is described along the well-illness continuum. One's position on this continuum is ever-changing and is influenced by the individual's physical condition, mental condition, and social well-being. At one end of the spectrum is wellness, a dynamic state of health in which an individual progresses toward a higher level of functioning, achieving an optimal balance between internal and external environment. Wellness represents the highest level of optimal health. Illness, at the opposite end of the spectrum, represents a diminished or impaired state of health. A balance of all aspects in life is the key to maintaining one's health. Factors that affect the level of wellness include age, gender, family relationships, emotional stressors, ethnic and cultural influences, and economic status. Consideration of the interrelationships among these variables is paramount when a nurse is planning and providing care. An all-inclusive approach to healthcare is known as holistic healthcare, a system of comprehension or total patient care that considers the physical, emotional, social, economic, and spiritual needs of a person. Maslow's model of health and illness. Several models of the wellness-illness continuum have been developed. These models enable the nurse to understand the patient's individual level of wellness and position on the continuum. The most common model was developed in the 1940s by Abraham Maslow. He believed that an individual's behavior is formed by the individual's attempts to meet essential human needs, which he identified as physiologic, safety and security, love and belongingness, and esteem and self-actualization. Maslow placed these needs into a conceptual hierarchy or pyramid that ranks them according to how basic each one is. A person has to meet needs at the base of the pyramid before advancing to the needs higher on the pyramid. Those needs placed higher on the pyramid are not requirements for life, but rather enhance it. Remembering that each patient may view or prioritize individual needs according to his or her own value system. Health promotion and illness prevention. From the earliest recorded civilizations to the 20th century, the primary focus of healthcare was on the care of the sick. Today's focus has broadened to include an emphasis on an awareness of the causes of disease and the prevention of its spread through the use of health promotion activities. In contrast to their origins as dirty, unsanitary, and ill-kept institutions where unsuspecting patients acquired diseases, hospitals have become clean, increasingly safe locations where patients and their family are cared for with limited fear that they will be exposed to additional illness and medical problems. The U.S. Department of Public Health works to help in the identification of disease types and related risk factors. These statistics identify problem areas for researchers and healthcare providers, who then direct their efforts at developing treatment for the illness, isolating its cause, and establishing methods to decrease its spread. The determination of cause and effect relationships provides a starting point for the development and implementation of health promotion initiatives. Today, 3 levels of health promotion are recognized. Their purpose is to promote health through maintaining wellness, preventing disease-related complications and reducing the infirmity associated with disease states. Primary prevention seeks to avoid disease states through wellness activities and preemptive screening programs such as mammograms, colonoscopies, and glucose screening. Secondary prevention recognizes the presence of disease but seeks to reduce the impact of the condition by encouraging behaviors to promote health. An example of this type of prevention is dietary teaching to a patient with diabetes with the intention to reduce episodes of hyperglycemia. The management of care activities for those with serious health problems who seek to improve the quality of life and reduce further loss of function are captured by tertiary prevention. Continuity of care. The patient is the focus of the healthcare system. However, many factors in our holistic healthcare system determines what actually happens in the care of each patient. The number of healthcare providers and healthcare agencies involved in the care and treatment of a single patient is extensive. Increased specialization by healthcare providers and healthcare institutions, reimbursement procedures by third-party payers, like insurance companies, cumbersome federal regulatory organizations, and state healthcare regulatory agencies affect the consumer, the patient, and the type of quality of care provided. One of the greatest challenges for the consumer of medical care is artful navigation of the healthcare delivery system. The consumer faces challenges to maintain autonomy and obtain continuity of care. Patients who are already weakened by the stresses of actual or potential medical conditions can become frightened as they attempt to understand the medical care and related choices available to them. Delivery of patient care. The care of the patients is a humanistic enterprise. It involves not only treating disease and injury, but also rehabilitation, caring for the chronically ill, and education of the patient, and to plan a systemic approach to individualized care plans with use of the nursing process. The purpose of the care plan is to meet the expressed needs of the patient. Its development involves the patient and all the healthcare providers who, through a coordinated and cooperative effort, work toward meeting the patient's total need in a holistic, caring manner. Participants in the healthcare system. Professional healthcare specialists. The patient is the central focus of activities performed by more than 200 types of healthcare providers identified in the healthcare system in the United States. Many professions require certification or licensure of their members. Within many disciplines are subspecialties of individuals who have advanced training and licensure. Registered nurses. The RN is a direct healthcare provider who is licensed after completion of one of the three types of nursing education programs. One of the three types of nursing education programs: a 4-year baccalaureate degree program, a 2-year associate's degree program, or a 3-year diploma program. RNs practice in a variety of settings inside and outside of the care facility. The RN's duties and tasks vary according to educational background and the state's Nurse Practice Act. Educational and career opportunities exist for the registered nurse beyond initial licensure. Nurses with master's degrees or doctorates represent a small but growing segment of the profession. These individuals often are termed advanced practice nurses. Their roles are expanded and may involve educator, administrator, and prescriptive authority. Lpns and Lvns. The LPN or LPN practice under the supervision of an RN or the physician. Working together, the LPN and RN are the direct patient caregivers in most institutions. The role of the LPN is based on the scope of practice outlined in each state's Nurse Practice Act. Other caregivers. Other caregivers also are required to be registered or licensed and to have the specialized education and training dictated by their professionals' organizations. Holistic care requires that professionals from different areas come together to provide comprehensive care. When a patient's condition dictates, referral to other care providers may be indicated. For example, social workers are trained to counsel patients who have social, emotional, or environmental problems. Physical therapists use precise methods of massage, exercise, and hydrotherapy to help restore physical function of the body. Dietitians are trained to determine the foods that meet the nutritional requirements of the patient. Respiratory therapists assist the patient by administering oxygen, monitoring and maintaining ventilators, drawing blood for blood gas analysis, and performing other pulmonary